Our question is, does childhood abuse contribute in the development of borderline personality disorder? The purpose of this presentation is to figure out the link between childhood abuse and the development of borderline personality disorder in adulthood, and whether the abuse contribute in its development or not. But first of all, what is childhood abuse, and what's borderline personality disorder? Childhood abuse is any physical, sexual, emotional maltreatment or neglect of a child. Borderline personality disorder is also known as BPD, or emotionally unstable personality disorder. The symptoms of this disorder are fear of abandonment, extreme mood swings, difficulty in relationships, unstable self-image, suicidal behavior, and self-harm. There are several causes for this disease: sexual abuse, early separation, inconsistent treatment of a caretaker, abandonment of parents. Since the rates of childhood sexual abuse reported by BPD patients ranged from 16% to 71%, this rate has been interpreted by others that sexual abuse is the main factor of the development of BPD. We have came through a study in an article called Pathological Childhood Experience Associated with the Development of BPD. The purpose of this study is to study the role of childhood sexual abuse and other types of abuse in developing BPD by studying 467 patients. A big group of 467 patients with different personality disorders were given questionnaires and research interviews to figure out who meets the criteria of BPD. After completing the interviews, 358 patients out of the 467 met the criteria of BPD, and 109 patients met the criteria of other personality disorders. To make this easier, I've decided to split them into two groups. Group A and Group B. Group A represents the 358 BPD patients, and Group B represents the 109 other personality disorder patients. After the two groups have been identified, as we call them A and B, tests began. Two tests were carried out. In test 1, it was between the 358 BPD patients in Group A and the other 109 personality disorder patients in Group B. They were all given research interviews to figure out the rates of abuse and neglect of BPD patients and patients with other diagnoses. The results of test 1 showed that higher percentage of BPD patients reported childhood sexual abuse. So since BPD patients reported more percentage of childhood sexual abuse, this might confirm the previous assumption that was made, which is that because BPD reported high child sexual abuse, then that means that child sexual abuse is the main factor that causes BPD. So another test was made to confirm these findings. Test 2 was made between the sexually abused BPD patients and the non-sexually abused BPD patients, where both groups were given questionnaires to test for other types of abuse. To make that easier to understand, let's think of it as if Group A, BPD patients, was divided into two groups, a sexually abused group and the non-sexually abused group. So here's Group A, and it was divided into the sexually abused group and the non-sexually abused group. Results of test 2 showed that sexually abused BPD patients reported higher percentage of other forms of child abuse than the non-sexually abused BPD patients. These results surprisingly means that sexual abuse almost always occurred in conjunction with at least one other type of abuse or neglect. since sexual abuse is almost always inclined with other types of abuse, and that childhood experience of both abuse and neglect are reported by a significantly higher percentage of BPD patients than comparison subjects, it is suggested that childhood sexual abuse is neither necessary nor sufficient for the development of BPD, and that other types of abuse plays a more central role. So these are the strengths and the limitation of the experiment. The strength for the number of participants were big. 467 participants. The study was double-blind. Patients had normal or better intelligence. Patients had no major psychotic disorder. However, the findings may not be generalized to less severely disturbed borderline outpatients. All the information was obtained through retrospective self-report, which could allow the patient himself to interpret his recalled memories. Thanks, everyone. And remember, say no to child abuse.